Okay, so just to introduce this presentation, my name is Patrick. I'm one of the clinical teaching fellows at Imperial College London in the UK. And this presentation is going to be on digital technology in endocrinology and diabetes. I've done a course in medical coding, and one of my colleagues who's helped with this presentation is one of our digital technology fellows. So that's why we're interested in this topic, and that's what we'll be talking about. The contents of the talk, we'll talk a bit briefly to begin with about digital technology and healthcare in general, and then we'll move on to why it's particularly applicable in endocrinology and diabetes. And then finally, which is probably the most part of the presentation, we're going to go through a case study that we've created. So just to start, everyone is obviously very aware, it came up even in the initial talk we had yesterday by one of the keynotes by Prof. Tynan, that digital technology is a very, very big thing in healthcare nowadays. The three main impacts we've got here are on the patient, on the clinicians, and on the organization. There's just an example on the right-hand side of your screen here of a very, very basic application that you can create within sort of 1 to 2 minutes just for an education perspective for patients to try and get them to receive some education on what sort of foods have higher amounts of sugar than others. In terms of patient applications, we heard yesterday how Alexa can be used to set off medication timings or reminders. And there have been some particular examples in the field of endocrinology which show sort of hard endpoints and soft endpoints. So if we talk about patient education and lifestyle, there have been studies which have shown that medical applications on mobiles can be associated with soft endpoint benefits, such as better glucose monitoring, better diet, better exercise, and then harder endpoints where a systematic review of the RCTs into self-management apps have shown that actually there's an association between app use and HbA1c reduction. Obviously, we have to take this with a wee bit of a pinch of salt based on patient populations and demographics, because as you can see with this study down at the bottom, the more elderly patients and the less tech-savvy patients obviously don't do quite so well when faced with new technology. Just as another example, you can see that this is big business trying to find any sort of improvement apps for young people. So you can get carb counting applications, and just from a very quick cursory Google search, there are over sort of 10, 15 readily available for people to use. Just want to take a moment now for everyone to have a quick look at your own phone. Look at the home screen, look at how many apps you've got for clinical use just on your home screen. So I've got at least 4. And I don't know if anyone will have seen these before. Some of them are probably UK based, but a few of them will have international ramifications. So this top one here, MD Calc, is sort of an interactive guideline where you can input things like risk scores for D-dimers. Down here, this is the Induction Healthcare app. It's sort of an inventory where it's got a catalogue of all the relevant numbers in hospital for people to call. Big time saver for the juniors. Now, the middle one, if you're not familiar with it, is the British National Formulary. This doesn't work outside the UK, though, so people may not have seen it, but it is a list of all the drugs we're able to prescribe in hospitals, their indications, their contraindications and interactions. And finally, you can get different interactive guidelines. This one's called micro guides, and you can get these put with your hospital guidelines so that juniors can see what local antibiotic regimens they should be tailoring treatment towards. So applications are very, very useful in healthcare. These are applications for the clinician which benefit the organization. If we look at endocrinology and diabetes specifically, we saw our colleagues in Croatia earlier showed us some algorithms in terms of diabetes treatment with different drugs. Endocrinology and diabetes as a specialty lends itself very readily towards algorithmic or flowchart type guidelines. Sort of if-when conditions, if the patient has heart failure, add in X, Y, Z. It's a field which is very readily available for app use. Just going to show you one of the guidelines from our local university trust. So I won't go through it because everyone's going to know this sort of thing very well, and we saw an example in the creation presentation earlier. So as you can see at the top, we've got an if condition. If they've not got cardiorenal comorbidity, we move down the left-hand side. If they do, we move down the right, and then depending on comorbidities, you change which drug you're going to prescribe. So you can see from this example that this is something which could translate quite well to an app on your phone to tell you exactly what you should prescribe next. If your patient has renal problems, move down this column, click a button, and you see what you should be prescribing. Another example would be in hospitals. One of the common questions the diabetes team get asked is, what should we do with this patient's insulin therapy in certain settings? So this example is in the last days of life. And each hospital will probably have separate guidelines for different types of patients. But again, this is a bit of a time drain on the referring recipient team. So here's the case study. This is what did we do about it. So we've developed an app, which you can see here, called EndoGuide. This is the landing page, so you can see that you can click on different topics, be it diabetes, be it electrolytes, vitamins, thyroid, steroids, and then subheadings underneath. So the user is able to click on electrolytes and move down onto one of the subdomains. My colleague Priyanka has created a video to go through it, which lasts sort of about 4 or 5 minutes, and hopefully you'll be able to hear. Let me know in the chat if you can't.
Firstly, hello, and thank you so much for giving us the opportunity to talk about our new endocrinology app. So my name is Priyanka. I'm a junior doctor working within the UK and currently working as a digital teaching fellow. So this is our endocrinology app, and this is the landing page that will turn up when someone clicks on the app, where you can see various different subcategories of endocrinology. For the purpose of today, we're just going to use an example, and I'm just going to click on electrolytes as an example today. When you click onto electrolytes, you can see all the various different electrolyte abnormalities that a patient can present with. So this is what someone will have to press on as a healthcare professional. But we can also go back at this point to see the main home page, or if you want to go straight to the home page, you click on EndoGuide at the top. So if we use hyponatremia as an example, we're going to see this page where the first question is acute symptomatic hyponatremia present? And we've got the symptoms there, so a healthcare professional can look at the symptoms. And at this point, if we click yes, for example, we're going to be taken to our next flow where the treatment of that section is given to us. However, if we go back and we click on no, we see there's a different treatment management plan given to us. So we can just follow that plan, get bloods panel, get urine screen panel, or consider stopping their medication. Then we go to the next step, and it asks us to assess the hydration status. So we've given the signs as well. They can see hypovolemia or hypervolemia. And if they click on hypovolemia, it's going to say treat with normal saline. So if we go back, just to pick on another example, hypervolemia, for example, again, it gives us a complete different management plan, treat the underlying cause, cardiac failure, renal failure, or liver failure. So for now, we're going to click on euvolemia because it's got quite a long flow. So if we click on euvolemia now, and then it's going to ask us to calculate the serum osmolality. And this is where the function of the app changes a lot, because we're trying to get interactive values from the actual healthcare professional. So for the purpose of today, we're going to use a serum sodium of 131, a urea of 10.7, and a glucose of 5.7 for this example. So once they've inputted those values, they can click submit, and then straight away it will give you a serum osmolality. So here we go, an answer, 278. And it tells you what to do with that value. So if we go back at this point and change the values, so we're going to change that serum sodium to 125, just to show a different example and a different flow. So we click on submit, and there we go. It says to check. It gives us a serum osmolality, but it also tells us to check the urine osmolality. So at this point, we're going to check the urine osmolality, and we can pick either less than 100 or more than 100. If we click less than 100, it says consider primary polydipsia. If we now go back, pick another option, more than 100, it tells us to check the urinary sodium. So at this point, it tells us that patient has hypertonic hyponatremia. So we're going to click less than 20 just as an example to show where the flow goes. It tells us to assess the hydration status again. Now, if I click on assess hydration status, it's going to take us straight away back to the start where we're assessing the hydration status. So I'm not going to go too far back, but if I go back and click more than 20, it asks us to calculate the electrolyte-free water clearance. So we've already got 125 from the previous input, which is great. And then we can input the urine potassium and urine sodium, and it gives us an electrolyte-free clearance of 0.35. And it tells us to commence 1 litre fluid restriction. So that's our app, and that's basically demonstrating the design of our app and what one flow can do within our app. And all you have to do is click on the top to take us right to the beginning. I hope you've enjoyed that demonstration, and thank you so much for giving the opportunity for us to show you our app.
Okay, so that's that was Priyanka's video demonstration. Now, I'm going to talk a wee bit more about what exactly we've done. So some of you may recognize this cycle, PDSA cycle, which is on the screen at the moment. That's essentially how to perform a quality improvement project, a QIP. So you identify the service needs, and we'll come on to how we did that in just a second. Then you implement a change, which in this case would be creating this app, and you analyze the effect the app has, and then try and make sure that it's a permanent improvement. We've basically walked through the hyponatremia guidelines just there anyway, so we're not going to linger on this for too long. But as you can see, I mentioned earlier that endocrinology guidelines tend to be very algorithmic, and you can see how this can quite easily lend towards an app. So the study aspects of the audit cycle here we could look at would be the number of times the local endocrinology service gets asked to come and see a patient with hyponatremia, and whether the referring team have already done the relevant investigations which allow you to make a more informed decision. So in what proportion of people have they already sent off some urine screens, for instance, because that has implications for patient flow and for how long people stay in hospital. This is just an Excel build of how we created the app. So it's a slightly more visual way of looking at different calculations than the algorithm itself. Put in your input in these boxes, and then we move to different arms of the app based on the output. And then I don't know if anyone has any experience with coding, but this is basically what underwrites all of the app. This is Java, JavaScript. So you can see here that this is the title of our page, hyponatremia. Boolean variables just essentially means true or false. So for this example, I've said this patient has euvolemia on the app. I've clicked euvolemia rather than hypo or hyper. We've put in all the values, and this system out print has given us what the app, what the computer would give us back if we'd said hypovolemia is true, if that's the patient's fluid status. At the bottom here, you can see that based on the actual values that we put in this section, that this is the output we would get. JavaScript would talk to the interface and tell us these results are in keeping with SIADH. Priyanka has previously input these values into our video, and I'm going to show you what happens if we change those. So you note here the urine osmolality is 160 that we put in. It tells us results are in keeping with SIADH. Keep your eye on the urine osmolality section. If we change it to 90, suddenly the algorithm is telling us actually we should be considering primary polydipsia. So this is hopefully a mechanism by which the referring team can try and get ahead of ordering investigations and a better idea of what's going on to help provide patient benefits. Similarly, as well as looking at hyponatremia, we could also do audits into what proportion of people are adhering to TKA guidelines, because again, this has patient outcome benefits, this has patient flow benefits, and other avenues you can look at would be things like drug costs. So our hospital guidelines from one of the hospitals within our medical school bracket show the possible approximate cost of different types of vitamin D replacements. So you can see here that whether we go with a once weekly regimen, a daily regimen, or in fact we go for an IM single dose regimen, the approximate cost changes. Also, we can save patients a great deal of tablet burden if we choose a once weekly rather than a once daily regimen. This sort of thing is another avenue we can audit with help from the hospital pharmacy department to see what cost benefits could be made from an app telling us the price and which one is the preferred option in terms of replacement therapy. So I've just gone over the perceived benefits of patient care, time and money outcomes, as well as the initial screening page where you would hopefully give the doctor seeing the patient a bit of a trigger that someone should go to an HDU environment in certain instances, such as here if we've got CNS disturbance. The app at present is not in a fully made stage. So moving on to do the audit is the next step. These things turns out are very expensive to run. Going back onto the guidelines page, you can see how well this sort of thing would lend itself to a yes/no interactive guideline, which is slightly better than just pulling up a PDF because you can input your patient's specific EGFR and specific comorbidities to tell you exactly what you should be doing. And this should lessen some load off some of the specialist services. So again, these are the various different PDSA QIP ideas that can be used, and that's the end of the talk. So we've gone briefly through different types of digital technology in healthcare and why they can be specifically relevant to endocrinology and diabetes, and we've walked you through the EndoGuide case study. That is the end of the presentation. Are there any questions?